Hello, my name is Tom Rogers Muyunga Mukasa. I'm happy to be here with you, and I hope we shall be part of this exuberant class. I would like to say, I'm sure many of you know me, and I know many of you, but maybe the professor doesn't. I joined the MPH Scholars team as someone who is working with communities in Africa, or who was working with communities in Africa, providing support to them to engage in activities that contribute to ending HIV, TB, malaria, hepatitis, COVID, female genital mutilation or cutting, and various harmful practices, as well as drug abuse and drug history use among young populations. I have worked in several African countries, and I've used my community organizing as well as public health knowledge to form action groups that drive demand for better and quality living practices. I also work among populations that are known as refugees, displaced persons, as well as asylum seekers. And this has been mostly in Kenya, Uganda, as well as Burundi and Tanzania. And in all cases, the governments there don't look at refugees from the definition of UNHCR. Yes, their definition is internationally accepted, but it is not like you would see refugees, for instance, in Palestine or the Middle East, rather, as well as Europe, how they are treated, maybe especially in Greece and all that. This is different because I've also visited those places and I've seen how refugees are treated and how refugees are treated in Africa. The policy is that in Africa, the idea of refuge, the idea of a displaced person or an asylum seeker within an African country who is also African, that concept is revised. And in Kenya, most especially in Kenya, they are basing on what is known as the Kenya Refugee Law 2021, which says that all registered refugees and asylum seekers have access to civil registration. And by that, it is translated as encampment. If a refugee is in a camp, this person is not supposed to come to Nairobi. That is called urban. So if a refugee is in urban areas, for instance, in Nairobi, that's where they're supposed to be staying, and they don't have to stay, or they don't have to go to stay, for instance, in another city. So there are public health issues around such kind of lack of movement to access areas where there are better services. So in my case, I came across refugees and displaced persons and asylum seekers who had TB, and in this case, TB that is known as XDR TB. That is what is called extensively drug-resistant tuberculosis, and this kind is resistant to at least 4 of the core anti-TB drugs. XDR TB involves resistance to the 2 most used and most powerful anti-TB drugs, isoniazid and rifampicin or rifampin in some cases. This very kind of drug resistance TB is also known as multi-drug resistance TB, MDR TB. So one has to move, for instance, from the camps to urban Nairobi, where they have to get medication. So one day I did support 3 refugees who were living with XDR TB to come to Nairobi and have their treatment. But it was a dilemma, I actually faced. Had a hard time, but we managed to navigate it and be able to get these refugees to care. So, it is a healthcare related issue. It's also an immigration related issue as well as policy issue in Kenya. But thank God, thank the Almighty that we managed to get them to care and do TB prevention work, but at the same time navigate the government policy around definition of refugees, displaced persons and asylum seekers, as well as linking these particular refugees to care because they were also living with what is known as extensively drug-resistant tuberculosis. I hope I've been able to show you the kind of scenarios that I work in and some of the issues that brought me to the MPH class, especially the Regis tailored MPH class. Again, my name is Tom Rogers Muyunga Mukasa, but I'm happy to be here and I'm happy to be working with all of you. I hope we shall be able to enjoy being in class together. Thank you very much and bye.